If we had done the public health measures correctly, both in the state as well as nationally, the first time, we wouldn't be here now.
Some strong words tonight from an Arizona doctor frustrated by what he calls inaction from state leaders as coronavirus cases continue to spike. I'm Danielle Lerner, and we begin ABC 15 News at 5 with his message to the governor. Our John GENOVESE talking with that doctor who says another partial shutdown may be the only way to curb this spiking coronavirus trend. John?
Yeah, and obviously that decision would need to come from Governor Doug Ducey, and so far he said publicly that he has no plans to implement any further restrictions. Just last week, he posted a video to Twitter reiterating the actions the state has already taken. But as this upward trend continues, doctors are urging new public health measures that could push businesses to the brink once again.
We needed to have acted 3 or 4 weeks ago as we saw the trends moving in the wrong direction.
A direction that has COVID-19 case counts, hospitalizations, and ICU bed use all rising and fast.
And we're doubling the number of cases basically at the rate of every 2 weeks.
Dr. Shad Marvasti is director of public health at UArizona's Phoenix Medical Campus. He says the governor should re-implement partial closures of high-risk indoor activities for at least 3 weeks. Places like restaurants, bars, movie theaters, and gyms.
Once we did that, we saw a 75% decrease in cases. So I don't think anything's changed in terms of that working. That can work again.
But that's a hard sell for business owners who have been suffering for months.
Restaurants were operating through early part of the fall and most of the summer without cases spiking. So to blame a particular business like restaurants, to me, is just very unfair.
Sheldon KNAPP owns the Phoenix City Grill near 16th Street and Bethany Home.
Being shut down in the middle of the season, I'm sure you've heard that before, it was a huge blow.
He says he was able to keep most of his staff, most of who have been there for more than a decade, on the payroll. But with no second stimulus on the way, that won't be the case if he's forced to switch to only takeout again.
As this thing goes deeper and deeper and longer, the more we're eating into those savings. So at some point, it's going to put us in a very precarious position.
It shouldn't just be, we're going to shut down and you guys figure it out. It's more like targeted closure indoor activities, switch to outdoors, and what resources and relief packages can we put together with tax dollars?
Protecting public health and the state's economy. Simply put, Dr. Shad says currently Arizona's handle on coronavirus is, quote, out of control.
Unless we act now for mitigation, both individually and collectively, it's only going to get worse.
In Phoenix, John GENOVESE, ABC 15, Arizona.